the insertion of the internal catheter. So we're going to start a Foley. First thing we're going to do is I'm going to wash my hands. Then I'm going to explain to my patient what I'm going to do and explain to them that I'm going to insert a tube into their bladder so that it drains off into a bag. I have to position you first, so I'm going to uncover you. I have provided privacy by closing the door. So I'm going to uncover all the way down to here. Because I need this area for a work area. I will have to expose you, so I will expose you. And then, if possible, you get your patient to go into a frog-leg position. And now that I have him positioned, I have to position my table, depending on if you're right or left-handed. Seeing that my dominant hand is right, I'm going to come to this side of the bed with my table and set it here at the foot of the table. Then I will open my kit. And to open this kit, you have to pull this white tab. Opening it here, and then just pull it out. This I'm going to use as a trash bag. So I'm going to roll this and make a good flat trash bag I can just drop my cotton balls into. I won't need this. I can throw this away into a trash can, and then I'm ready to open my kit. On the back of this, there is a piece of tape right here, and it's holding this flap down. Do not try to peel that tape off because you may end up ripping your sterile field. Just rip that corner off and let it open. This is actually designed that once you have opened that, you can just take this flap and open it that way and then turn it back towards you, and that's your first flap that has opened away from you. Then you're going to open up the side flaps, remembering that this is a sterile field and I do not want to contaminate in my sterile field. Every sterile field has a 1-inch border that you can touch, but you can't touch beyond that 1-inch border. So I'm going to open this by pinching this open and pinching this side open, then using that 1-inch border to straighten and flatten it to make sure it doesn't flip back into my sterile field. This last flap, I'm not going to reach into my sterile field to get it. I'm going to simply pinch it from the back here and pull it toward me, and then use my 1-inch border to flatten and straighten. And I will straighten this so that it is straight on my table, like that. Now, if you look at this flap here, you can see that it has a fold on it. And this fold has a shiny side and a dull side. That shiny side is the side that's going to go down. So it's folded like that so that you can touch that shiny side without contaminating the other side. Here, I'm going to step away from my sterile field. I'm going to open this, and if I have to, use my 1-inch border all the way around just to open it up. I don't want to shape this. Then this lays shiny side down right in between the legs, thusly. Okay, now you see that I have a pair of gloves there. I'm going to pinch those gloves out, put them to the side. Then I'm going to step over this side, making sure I can keep an eye on my patient and on my sterile field, and I'm going to put my sterile gloves on. Opening these sterile, making sure I fold these so that they do not get contaminated, and this does not fold back into my gloves. First one, I'm going to grab the cuff and pinch the cuff knowing that these are set up with my palms up, thumbs out, slide this first hand in there. Then once I've got that on, now I take these fingers and I slide under this cuff. And then put my hand in, keeping my thumb here up. Careful when you take this off, making sure that that does not cross into your sterile field here, because I'm practically into my sterile field there, so I can get that out of there. I can touch sterile to sterile, but I can't touch that 1 inch border now with my sterile gloves on. I'm going to get rid of this so that it does not get into my sterile field. I'm going to keep my sterile hands up at all times, praying position, and out in front of me. This is called a fenestrated drape, and it is a drape that you can put over the genitals for another sterile barrier. This is an optional drape, so you can opt out of using this. And I think I will opt out. Then this has lube in it. It has my betadine soap in it. With the lube, you will simulate that you're going to open this, put a glob right here, so that you can come back to it later. You're going to simulate too that you're going to open this betadine soap and soak your gauze or your cotton balls, and then put this to the side. Now take this, put it over here to one side, then take the tray off the top, put it to this side here, the closest to the patient, because this has your gauze so that you can work right near your patient with it. Now I have to set up my catheter. So here I've got a sheath, a blue protector on this. What we want you to do with this is take this off, and keeping that sterile and in that box, slide that off, making sure your tube does not contaminate anything. Take this and throw it away. Now where I put that gel, I'm going to lubricate the tip of my catheter. A good 2 to 3 inches on that. Some good lubrication on there. I'm going to also now take my sterile water, or sterile water in the syringe, remove the cap, and place it right here on this valve at the bifurcation. And you push that in and make sure it's good and snug. And then just put all that back into the box. Then I'm going to take my tweezers, my pickups here, and I'm going to tell them, I'm going to touch now. And this is where I will touch my patient. I will grab hold, and once I've touched with that hand, I will never let go of that. This hand will never go back into my sterile field. I will take the first cotton ball. This has been soaked with betadine. I will start at the meatus, the opening of the penis, and work my way down spirally along the glands to the bottom of the glands. The glands is the head of the penis. So I clean all the way from top to bottom, throw that one into that trash can that I put, grab me another one, start here, work my way down again, and into the trash. Another one, and then trash. And you will do all 5 of these. Now with the last one done, I don't need those anymore, so I will put those right there. Just dropping everything because I must keep this hand sterile. ready to insert my catheter. So I will grab my box with my sterile hand, lift it from the end so that I can swing it around without touching my patient, and put it right here on that drape. Then I will take my lubricated tip and I will say, okay, you take some deep breaths now, and I will insert. And I will just keep inserting, making sure I don't touch my sterile hand to the end of the penis. Insert it all the way. For a male, you will go all the way to the Y, or the bifurcation of the tube, to there. Then I take my normal saline, my sterile water, and I fill up that balloon that's at the end of the catheter. Now that I've got that all the way down, I want to hold pressure there. All the sterile part is in, so I can let go, so I can touch here and pull that off to keep that water in there. This can be thrown that way, and then I will gently tug back until I get some resistance. And then what I'm going to do is take this out of there. I will secure this with some tape right here, or a securement device, such as a Foley securement device that can stick to the skin. But a good piece of foam tape would be good here, just making sure that you have enough slack in there that you can get the patient up and walk without it tugging toward the end. Then, once I've secured that, this goes to bed frame, not the bed rail, but bed frame. So I will put it on the bed frame. Then clean up. And it is good to wash off any excess betadine here, because betadine can irritate the skin. And